Dr. Sara Cuccurullo is Medical Director and Vice President, JFK Johnson Rehabilitation Institute. Good to see you.
Good to see you, too.
Put this in perspective. You deal with stroke?
Yes.
First of all, what is a stroke?
So a stroke is a sudden focal neurologic deficit that is secondary to occlusion or hemorrhage of the vessels within the brain. If the symptoms only last 24 hours, it's called a TIA, or a transient ischemic attack. But if it lasts more than 24 hours, it's a stroke.
A couple things. JFK, part of a larger healthcare system,
Yes.
otherwise known as?
The Hackensack Meridian Health Network.
A supporter of what we're doing here. I want to clarify a couple things. Number one, people watching right now are saying, so what are the warning signs? And I bet you there are warning signs that could be confused with something else, or maybe not.
Yes.
What are the most common warning signs of a stroke?
So the most common warning signs of a stroke are hemiplegia, or weakness of the arm and leg, and sensory deficits of the arm and leg. Is it on one side,
doctor, both?
It can be on one side. The face is also involved. Depending on the location, the face and the arm and leg can be on different sides.
Okay,
but
so
typically it's unilateral.
All right,
typically it's
that's
unilateral.
one. What
side.
else?
The next is speech deficits. Patients can have problems with speaking. They can have problems with swallowing. You'll notice your loved one choking on water if they're trying to drink water. You'll see a facial droop. You'll also see that maybe they'll have this confusion. They could have balance deficits, gait, and the problems with walking. There's a mnemonic that people can utilize to, if they think someone's having a stroke, it's called FAST, which would...
F-A-S-T?
F-A-S-T, F for the face, A for the arm and leg, and then S for the speech, and then time. T is for time, because you have to, when you identify these symptoms, you need to move quickly. You need to get to the patient via ambulance to the hospital as soon as possible.
Because?
Because time is brain.
Play this out a little bit.
Yeah, because if you wait beyond a certain period of time, typically about 4.5 hours, you're not going to be able to utilize some of the newest interventions in caring for stroke patients. So you want to get the patient, and once you call EMS, they come, they do a full assessment, they notify the emergency room that they're coming in. There's CAT scan that's made available. The patients go in, get a full assessment, and get treated immediately. And the quicker we treat the patients, the better the outcomes.
Doctor, what about, you've said several times if there's a loved one involved. What about if you're alone?
If you're alone and you see this going on, the first thing you should do, if you're capable, is call 911 or call a neighbor to help you to get the EMS. Some families try to, of course, a lot of people are resistant to want an ambulance to come to their house. They're concerned about the commotion that it will cause. But the ambulance piece is very, very important, because those patients that the families take them in on their own, there's a lot of time wasted. The ER is not prepared when you come in. So it's very important. And you want the best outcome once you see this occurring.
It's so interesting that people will sometimes say, I don't want to cause a commotion, or it's not something I would do normally. You're rolling the dice big time. Yes. If you choose not to do this.
Right.
Because if it isn't that, I hate to use this expression, no harm, no foul. If it is, you have to be in a position with clinical professionals with all the best technology to get the help you need.
Correct, okay. Absolutely.
You have a study, right? Talk about the study that it's the Institute's Stroke Recovery Program. And is there a study connected to it as well?
Yes, actually, it's called the Stroke Recovery Program. It's an IRB-approved research study.
That means?
Internal Review Board.
Okay.
It's vetted out through the research experts within our academic setting, and it's a study that looks at patients who have had a stroke, and it's based off a model that was put out by Mayo Clinic, because if you think about stroke is vascular disease of the brain. And cardiac patients have vascular disease of the heart. So when we were expanding our rehab institute, we were expanding the cardiac division of our cardiac rehab program. And in expanding it, we looked at best practices across the country. We saw that Mayo Clinic had an amazing cardiac rehab program, and we implemented that within our institute. And what cardiac rehab does is it puts patients through 36 sessions of cardiovascular conditioning post post-cardiac event.
Cardiovascular conditioning, which entails?
Which is kind of aerobic exercise. That's whether you're on the treadmill or on a bike or running around a track. It's cardiovascular exercise.
What does that do with stroke?
So what this is when in looking at this cardiac program for patients who have cardiac disease, Mayo Clinic proved, because the vascular system in the heart is the same as that in the brain. When we were looking at all the outcomes that came from the cardiac rehab program, it showed that doing these 36 sessions of cardiovascular conditioning in addition to nutritional support, rehab psychology, and risk factor management, these cardiac patients had a major reduction in the mortality, 45% reduction. So someone post-heart attack or post-stent placement who does this cardiac rehab program, which takes about 3 to 4 months, they have a 45% reduction in mortality. And if anybody came up with a pill to do that, they would win the Nobel Prize. So what we said was, this is working so well. It's a 3 to 4 month program that's fully funded by Medicare because research was done that proved...
Medicare does?
Medicare funds cardiac rehab fully. And research was done to prove it, so they had data-driven research to show that it worked. What I realized, and myself and Dr. Fleming are the co-PIs on this project, what we saw was that the stroke patients had
PIs are principal investigators of a research grant. Go ahead.
Yes, exactly. So what we realized is our stroke population, which we get about 750 stroke admissions a year into our facility, our stroke patients had no comprehensive program that afforded them this type of outcome. So we said, the fact that it's the same vascular system, what if we did this cardiovascular conditioning on stroke patients? And when we started talking to our peers, other physicians, and we were applying for grants, people were saying, how are you going to do aerobic exercising or conditioning with someone who's hemiplegic,
right,
with someone who can't use their arm or their leg?
What's the answer to that? I got a few seconds left. What's the answer to that?
The answer to that was to utilize a cross-training recumbent bike that would allow, we have a hand mitt for the hand, it's called the New Step, and a leg brace for the leg. And in using that, we're able to put these patients through almost an identical program as cardiac rehab, but get these stroke patients on these cross-training recumbent bikes. In addition to, they do that for 36 sessions, in addition to PT, OT, speech, and the risk factor management, smoking cessation, and a full comprehensive program.
Model.
And a potential national model. We published a paper in November that showed that the normal mortality of a stroke patient, a 1 year post-stroke, all-cause mortality is 31%. Our study showed that the mortality was down to 1.47% for patients that went through this program.
Dr. Cuccurullo, I'm sorry for interrupting. I know there's more to talk about. I wish we had more time.
Okay.
Well said. One more time. Time is?
Brain.
Well said. Thank you, doctor.
Thank you very much.
We'll catch you next time, folks.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Valley Bank, New Jersey Sharing Network, PSE&G, the Healthcare Foundation of New Jersey, NJM Insurance Group, the Fidelco Group, the New Jersey Education Association, the Russell Berry Foundation, and by Fedway Associates, Inc. Promotional support provided by NJ.com and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.